Cuban health authorities say that starting this weekend, arriving travelers from 8 South African nations must submit, along with a COVID-19 vaccination certificate, a 72-hour negative PCR test, quarantine for 7 days, and take a second test. The multiple precautionary measures follow the spread of the Omicron variant, which has triggered alarms around the world.
No estoy pesimista, pero bueno.
I'm not pessimistic. Our vaccines can help overcome the virus and not get infected with the new coronavirus variant.
We have to closely follow this new variant, which is more contagious. Let's wait and see. I trust Cuban scientists.
Latin America, with a sporadic rollout of COVID-19 vaccines, has seen a decrease in infections and improving indicators compared to other regions. Countries like Argentina, Brazil, and Cuba show growing immunization, some with numbers surpassing those reached by the United States. Cuba is approaching nearly 1 million COVID-19 cases and more than 8,300 deaths since the beginning of the pandemic. The island, whose economy depends on tourism, has significantly controlled the spread, reporting fewer than 200 confirmed daily cases in recent weeks, mostly credited to vaccination programs. Up to late November, over 81% of the 11 million Cuban population had already been fully vaccinated against COVID-19, while Cuban health authorities expect to have more than 90% of all Cubans immunized before the year's end. Even with the success of locally developed vaccines, Cuban health authorities have always insisted that no one should lower their guard.
No por el hecho de que la mayor parte ya de la población cubana.
The fact that most of the population, including our children, has been partially or fully vaccinated does not mean that we should drop protection measures like face masks, frequent hand washing, personal distancing. This is quite a different stage in the fight against COVID-19, but it still requires sanitary and precaution measures.
According to the World Health Organization, the new Omicron variant poses a very high global risk, especially to countries with low vaccination rates. Chirino, CGTN, Havana.